Good morning and welcome to this week's edition of NHIS in a Week. Here, we give you happenings and insights of the authority and the scheme. My name is Bridget Appiah. Now the headlines. Deputy CEO tours Northern regions to strengthen NHIS operations. NHIS intensifies action against illegal charges. Over 3,000 members registered in the Volta market campaign. Now to our first story. The Deputy Chief Executive of the National Health Insurance Authority, in charge of Administration and Human Resources, Mr. Raphael Sepep, has concluded a week-long working tour of the 5 northern regions. The visits formed part of the authority's efforts to strengthen the operations of the National Health Insurance Scheme and engage staff across the regions.
The tour began on March 2nd and covered the Upper West, Savannah, Upper East, Northeast, and Northern regions. Mr. Sekpeb was accompanied by a team of senior officials of the authority. During the engagements, Mr. Sekpeb highlighted the vision of the NHIS Chief Executive, Dr. Victor Asari Bampo.
You look at the 3-point vision of the Chief Executive. We're looking at enhancing internal controls to promote efficiency and staff welfare. We're looking at restoring trust so as to ensure people have access to healthcare and have an impactful NHI experience when they enter hospital.
The vision focuses on strengthening internal controls and staff welfare, eliminating illegal charges under the scheme, and aligning the NHIS with government programs such as free primary health care and the Ghana Medical Trust Fund, also known as Mahama Cares. The team also inspected a number of NHIA projects, including the proposed Takbo Polyclinic in the Naduruli Kalio district, the Bole district office in the Savannah region, and the site for the Tamale Claims Processing Center. Mr. Sekbeb also indicated that plans are underway to construct additional district offices and provide operational vehicles to support service delivery in some districts.
Moving on, the National Health Insurance Authority has reiterated its commitment to addressing illegal charges under the National Health Insurance Scheme. The authority says healthcare providers found engaging in such practices will face strict sanctions.
The Deputy Chief Executive for Administration and Human Resources, Mr. Raphael Sekbek, issued a warning during an engagement with management of the Northern Regional Claims Processing Center in Tamale. According to him, healthcare providers who submit fraudulent claims or charge illegal fees will face measures like refund, suspension, and possible prosecution. He also cautioned NHI staff against collaborating with dishonest providers who exploit NHI's members at health facilities.
We are also very much aware that, as we found elsewhere, that some of us may, in one way or the other, be responsible for some of the fraudulent claims that may come true. I have no evidence to this effect, and we have not caught anybody. But what we're saying is that if any of us is tempted by a provider or a facility to come and assist them in that fraud, we should not be participants.
Mr. Sekbe disclosed that the authority is working towards establishing a permanent anti-illegal charges directorate to strengthen investigations and enforcement. The move is expected to help protect NHI's members, reduce financial leakages, and maintain public confidence in the scheme. The move is expected to help protect NHI's members, reduce financial leakages, and maintain public confidence in the scheme.
The National Health Insurance Authority has registered more than 3,000 people on the first day of its provider and client relations for Universal Health Coverage Market Durbar campaign in the Volta region. The campaign forms part of ongoing efforts to expand NHIS coverage and engage communities directly.
The 2-week initiative, which began on March 2nd, is being led by the Deputy Director for Provider and Client Relations, Madam Hamdia Amadou Yakubu, in collaboration with the Volta Regional Director, Madam Susan Choba. The outreach is taking place in 10 locations across the region, including Pando, Mafi Kumasi, Aflaodenu, Akachi, Joje, Ho, Hohoi, Keta, North Day, and South Day. On the first day of the exercise, over 3,000 people were registered or had their membership renewed in the North Tongue district. The exercise also includes public education on NHIS service and the national campaign against illegal charges.
Moving on, the Waja District Office of the National Health Insurance Authority has supported a week-long NHIS registration and renewal exercise under the Health Train 2026 initiative. The program was organized to improve access to healthcare services in communities within the Waja constituency.
The exercise took place from March 2nd to March 6th and was facilitated by the Member of Parliament for the area, Honorable Ahmed Jerry. Residents benefited from services including NHIS registration and renewal, general medical screening, and eye examinations. Some residents also received free cataract and pterygium surgeries under the Health Train Eye Care Project. The initiative forms part of the authority's ongoing effort to expand NHIS coverage and ensure access to healthcare services.
Now to our final story. The Ayawaso District of the National Health Insurance Authority marked Ghana's Independence Day with a special NHIS registration and renewal exercise. The activity was organized to make NHIS services more accessible to residents within the district.
The exercise took place at 4 municipal parade grounds including Ayawaso East, Ayawaso West, Ayawaso North, and Ayawaso Central. Officials used the opportunity to register new members in the National Health Insurance Scheme and assist existing members in renewing their cards. The authority continues to encourage the public to enroll in the scheme and renew their membership regularly through the My NHIS mobile application or at the nearest NHIS district office.
Jimmy Ruffle, I don't understand. I hope you've been taking your medication. I do better. Hey, foul. And I say, be Pedro board damn.
Hello, ma'am.
Hello.
Good afternoon.
Good afternoon.
My name is Adam. From National Health Insurance Scheme, I'm here with my colleague and would like to talk to you about the new NHIS app.
Oh, so you people are here to test my faith, eh? Listen, let me tell you. There's no power above or beneath that can compete with the supernatural. There's no better health insurance than being kept by the power. And I'm kept by the power. And my whole family is covered. Oh, let's see what they have to say.
No need to worry, Ghana. At the Power of Ye, with over 500 medicines to take care of you, the new NHIS app has you covered. All you need is a valid Ghana card to register for yourself and for others. My NHIS app gives you access to credentialed health facilities and services across the country. Access to healthcare just got easier.
Download the My NHIS app to register yourself, your family, and your loved ones. Yes, you can register and renew NHIS membership for others too. All you need is a valid Ghana card. The new NHIS app gives you access to credentialed health facilities and services across the country with an extensive benefits package. Access to healthcare just got easier.
Jimmy Ghana card, you know, register, man, says, yeah.
National Health Insurance Scheme, your access to healthcare. Download on Google Play Store or Apple App Store. Terms and conditions apply.
This brings us to the end of this week's edition of NHIS in a Week. For more stories, log on to our website on www.nhis.gov.gh and visit our social media platforms displayed on the screen. My name is Bridget Appiah. Thank you for watching.